Welcome back, karibuni sana and bienvenidos to this channel Huku Abroad. And as you can hear guys, today my voice is not really good, but we have to do a video as bad as it sounds. And today guys, I'm going to talk about something that I really like in this Spain, and it's about the health system. And so let me first say that I'm a Kenyan and I have been in a medical field for so long. I've done pharmaceutical technologist in college for 3 years. And when I was in Kenya, when I would hear about the countries that have a good health system, Spain was among them. And so today I'm here to give you my experience in this health system. And so if this is what you'd like to hear, you're welcome. And so to start with, Spain has 2 health systems, that is the public and the private. I'm going to talk about the public one. This is the one that is under the government. And to be in this public health system, you'll need to pay taxes as long as you're working. And also those people who are not working will also be able to pay for the social security. But the best thing about this system is that if you're not working and maybe you're not able to pay for this social security, and you're going to be in Spain for more than 3 months, that's not as a tourist, you will also enjoy the public health services. And so that is one thing that makes this health just a good thing. And also the other thing is that after paying the taxes, now the hospital becomes free. I mean, you will not be able to add some more money, like the way you'll get some places you'll have to copay, or they don't cover other services, but here all those services you're going to get them free. Now the next thing will be how to get into this public health. So if you coming to stay in Spain, there is this thing that is very common and you'll need it. It's an address of where you'll be living. They call it a padronamiento. And with this, the government will be able to allocate you a hospital or a school if you have kids. And so in Spain, you don't choose where to go, but you go to the hospital, which is near where you stay, and the school also, it's where you stay. That's where you'll be allocated a school. And so when you get this allocation of the hospital, you need to go to the hospital and register. And they'll be able to give you a letter as you wait for your card, the health card. And the good thing is that when you have this letter, you will be able to go to the doctor. So the system is divided into 3 hospitals. So there is the one that is just near you, and that one is called the Central Salud. It's like the normal clinic. And the best thing about these clinics is that there are so many. Like you'll find 1 kilometer this one. After a few kilometers, there is another one. And so you don't have to go very far for the services of these clinics. And so in the clinic, you'll be able to be allocated a family doctor for the adults, a pediatric doctor for the kids, and you'll also have a nurse. And also in this hospital, you'll have services for a matron. And they also have a lab that's only for collecting specimens. And in these hospitals, you'll be able to book appointment either by booking it online, or you just walk into the reception and they'll give you an appointment. And also, talking about the appointment, let me say for the adults, the appointment you might find one that is a bit far, like we can say a week. But for the children, The appointments are very close. And the best thing about this is that even though you had an appointment and you feel bad before your appointment time, or you have an emergency or something that can't wait, you just need to walk in these hospital clinics and the receptionist will be able to let you be seen by the doctor. And so in this setup, you'll have to have a family doctor for you and pediatrician for your kid, and you'll have a nurse for your kids and also a nurse for the adults. And the best thing about this is that you can change these doctors. That is because some will just come in the morning and some will come in the evening. And so you'll choose which time is best for you to be seen by the doctor, or when your doctor is in the shift. And the other thing to note on this one is that your family doctor is very important, because it's only him who will be able to give you an appointment to now the consultant. And so here you don't book for consultant online, but you'll have to get a letter from the doctor. And also the other thing is that this hospital will only operate during daytime. That is from 7 to 8, and I think clinics start at 9. And so if you're sick during the public holidays and during the weekends and at night, you'll have to go to the main hospital. Second hospital is a hospital for specialists or consultants. And this hospital you'll go after you have been referred from the clinics. And also in this hospital, you'll be able now to get like x-rays. And also now the services for consultants. And the other thing is that these now clinics only also operate during the day. And so mostly are for the patients that don't need admission. And so from the special clinics, if you have a problem that needs to be looked into or that needs to be admitted, now this you'll be able to be sent to the main hospital. And the third one is the main hospital. And here you'll be able to come when you have an emergency during public holidays and weekends. And if you have been referred from the other two hospitals, that the special hospital and the clinic. And so this is the only place that have inpatients and also have now all the other departments. And so if you're sent to this main hospital, you'll find they will be take more your cases more seriously. They are very good doctors in this hospital. And the best thing I found out in this hospital is that the doctors will specialize only in one line. And so I found out that if you have an example, a problem with your blood, and maybe you have anemia, and maybe also your white blood cells are not okay, your red blood cells are not okay, you will find that you'll be seen by almost 4 doctors in this line. And the best thing is that they will let you go when they have really treated you. And if you are not treated, they will have to give you some appointments and they will follow you until you are treated or they are okay to let you go. And something else also I noted is that it will depend on how fast you need the treatment. And by that I mean if it's something that needs to be attended urgently, it will be treated urgent. And that's something I found so good, with this health system. The thing is about the system. So the system is well connected such that even though you get sick in any other part of Spain and you're registered in this system, you'll only need to go and say your name, give your name, and they'll be able to see all the other patient history. And also to note is that the pharmacy also can be able to connect with the hospital, and so the doctor will be able to do a prescription online, and you just need to present yourself to the pharmacy with a card and you'll get the medicine. And the other beautiful thing about this that I can't forget to say is about the medication. And so when you get a prescription from the doctor, you're able to enjoy a discount on the prescriptions drugs. And something I would tell you about this is that the discount will really make the price for the medicine go really low. And so this also another thing I noted that also makes this health system in Spain very good. The only thing that is not covered in this system is the dental. But you'll find that your kids between age of 6 up to maybe 18, I'm not so sure, they will still get to see a dentist. And I think there are more changes on this. I've not been into it, so I can talk more about it, but the best thing is that there is that age that will be seen by the doctor, also otherwise free. And to top it all, with this public health system of Spain, I was able to give birth normally after giving birth to my firstborn in Kenya through CS, that's through cesarean section. And this, I would say, is something I would like to discuss in a different video about my journey of pregnancy in Spain. And so I'll do that later. Those are just some few points that I noted with this public health system, and I'm quite sure there's so much more to learn. And by this, then I'll come to the end of this topic today. And if you really liked what I discussed here, you can please like, share, subscribe, and also you can comment and maybe ask a question about this public health system in Spain. Thank you all, and see you in the next video. Adios.